Hi, my name is Jackie Bronico, and welcome to the Mindful Space. I'm an internist, which means my specialty is in internal medicine. I also have a secondary specialty in preventive medicine and public health. All that together just means there's a lot of different approaches that I like to use and kind of offer to folks when they're thinking about their mental health, kind of looking for other tools, things to maybe augment or complement things that they're already doing. And a couple of those things would be psychopharmacology, so different types of medications, if that's something that you're interested in pursuing. Also different kinds of evidence-based supplementation, so different nutrients or minerals, supplements that have been shown to improve mental health, general well-being, inflammation, those sorts of things. Obviously lifestyle recommendations as well, so we often spend time chatting about that. Otherwise, I do have a pretty holistic approach, so other things that I do find can be helpful sometimes are mindfulness practices, so that's something you might be familiar with in terms of meditation. There's a certain kind of protocol that I do teach. It's called Mindfulness-Based Cognitive Therapy, or MBCT, and there's a lot of different mindfulness-based interventions these days, so you might have heard a couple different ones. This one in particular kind of bridges two different things, so mindfulness practices, some a little bit more traditional, some less so, and also cognitive behavioral type of exercises. So, and it isn't talk therapy, but we do kind of go through a lot of skill building, different scenarios, kind of guide you through some practices. Something that I also really like doing is offering a lot of different options. So in terms of practicing, sometimes there can be this rigid kind of thinking around mindfulness. For me, I find that it's mostly a lifestyle, and it can be very flexible. So I particularly have additional experience in ADHD and ASD type of modifications for mindfulness practices. So there's a lot of different options that we kind of go through in terms of finding a fit for you, instead of you trying to fit the way that, a standard approach for some of these practices. So we can definitely spend a lot of time talking about that. I do have kind of this penchant for different neurotypes and kind of modifying things, making space for folks, kind of finding things that work for them, in part because I do have lived experience in addition to professional experience. So that's something that I know very well from a lot of different perspectives, as well as just being a patient in the world, seeking medical care, or being a client seeking mental health care. Definitely some experiences have been helpful, some not so much, and so I do definitely empathize with that. I actually often see folks after they've kind of seen a few other medical doctors, maybe didn't jive with them, or didn't kind of get the approach they were looking for. So a lot of the times folks do seek me out just to have a different approach, kind of a different conversation. I do see myself as a partner in your healthcare, so definitely something that we figure out together, and not just because I think that's a good approach, but it's also an evidence-based approach. The more that you feel confident about your treatment, the more you feel involved, actually the better outcomes are found. So that's something that benefits everyone, I think. And otherwise, I do think that, we could be a good match potentially. I think the most important thing is for you to find a good match. Again, research in this area also states that better outcomes are found when folks actually do have a very good therapeutic alliance with their provider. Also better communication if there's concordance in terms of neurotype, and better outcomes, if there's other types of concordances, just meaning match, in terms of, race, ethnicity, different things like that. So I'm happy to help you find your next provider. If it seems like we might not jive, that's totally fine. But if you're interested, do reach out. I'll share some information with you, and maybe after you review that, you might get a better idea if we'd be a good match, if I can help serve some of your goals, and hopefully we'll see each other soon. So thanks for stopping by. Thanks for, even if it's not for these services, do feel free to check out our site. There's a lot of other educational things that we do put on. So good seeing you. Take care, and best of luck in all of your journey.